Good afternoon and welcome to St. Clair County's daily COVID briefing. I'm joined today with EMA Director Herb Simmons, and we'll get right into the numbers for St. Clair County. St. Clair County has tested 285,015. That's an increase since yesterday of 828. Positive test results are 27,942. That is an increase of 58 since yesterday, and those include males and females under the age of 1 up into their 90s. That brings our daily county positivity rate to 7%. For negative test results, we're at 257,073. We are happy to report no new additional COVID-related deaths in St. Clair County, so that number does remain at 445. For those that have completed their IDPH required 10-day isolation period, we're at 26,945. For state totals, they've tested 18,069,753, with positive test results of 1,185,447. That's an increase since yesterday of 1,780. Unfortunately, the state did announce 34 additional COVID-related deaths, bringing the statewide death total to 20,494. For hospitalization numbers, starting with St. Clair County hospitals, we have 58 patients admitted due to COVID-related illness. However, 4 of those patients are on ventilators. Regionally, we have 85 patients admitted due to COVID-related illness, and 8 of them are on ventilators. For our congregate living facilities and outbreak status, we'll only announce the changes, and these are cumulative numbers. Sycamore Village in Swansea has 41 cases and 1 death, and that is an increase of 1 case. I'll now turn it over to Director Simmons for his update.
Thanks, Brian. We'll go into the zip code report. 62203 goes up 1 to 595. 62204 goes up 1 to 381. 62205 goes up 2 to 622. 62207 goes up 4 to 572. 62208 goes up 1 to 1,569. 62220 goes up 10 to 1,993. 62221 goes up 1 to 2,685. 62223 goes up 7 to 1,687. 62226 goes up 6 to 3,079. 62232 goes up 4 to 870. 62239 goes up 3 to 448. 62240 goes up 1 to 153. 62243 goes up 2 to 743. 62269 goes up 4 to 3,151. And 62285 goes up 2 to 550. As Brian said, our daily county positivity rate jumped up to 7.0 today, which is up from 5.1 yesterday. The regional positivity is at 3.9, which is down from the 4.1 was yesterday. Our county 7-day rolling average went up to 5.0, up from the 4.9 yesterday. The other counties checked in today: Bond County at 1.4%, Clinton County 1.9%, Madison County 4.9%, Monroe 4.2%, Randolph 1.0%, St. Clair 5.2%, and Washington at 45.6.
That's an error. 5.6.
That's an error. It's a long day. It's 5.6. It's a long day. Brian, a lot better traffic flow today. I think a lot of our citizens listened to come on their scheduled times.
Yep, it's definitely the message is getting out. Those that have appointments are getting a reminder the night before via text message and email telling them, please don't arrive early, your vaccine will be there. And that's the best message we can get out. If you have an appointment, there is a dose for you. The vaccine, when it comes in, that's when appointments are made. So whether your appointment is at 8 a.m. or it's at 7 p.m., if you have that appointment, we have a vaccine for you. So you don't have to rush down in the morning out of fear that it's not going to be there.
Right. And even though it got crowded today, I mean, we had, 700 cars, you think, on there? The traffic wasn't backed up into the neighborhoods. It kept it off of the South Belt. Kudos to the law enforcement officers out there keeping the traffic flowing, and kudos to all of those that showed up today. There were still some that came early, some of them that just wanted to get there because they're afraid that vaccine is not going to be there. As Brian just said, if you've got the appointment, your dose is there for you, and we don't leave there until every dose is in somebody's arm.
And I saw a lot of questions today, and believe me, we try and get back to everything we can, but the questions just come in as quick as the day goes. Lots of questions about, will they cancel my appointment if I'm stuck in line? Because sometimes the lines do get long, and no. As of right now, typically they would cancel appointments for those that are an hour late, but if we have a line like that, they are not canceling your appointment. Please just be on time. Don't worry that you're in line and your appointment's going to be canceled because you haven't got to that checkpoint by that point. Your appointment's going to be there, your vaccine's going to be there.
Well, and like I said, yesterday we did just under 2,000 doses, 1,900 and some doses.
Yeah, about 1,944 went through yesterday.
So you figure, I mean, we are doing what this mission has called for, and that's putting needles in the arms. And again, thanks to our National Guard troops, our medical staff, that's they're just as working as quickly and safely as possible, as we say every day. They're doing a tremendous job. As I said, those who are helping keep the traffic flowing. Again, we apologize for any inconvenience of people who get there. We can't control. We can only ask people to show up at their scheduled time. And I know there's been all kinds of messages saying, well, why don't you kick those people out? Well, once they get in the lot, the way it's configured, it'd be more of a hassle trying to do that or stopping them at the front gate.
Questions about why aren't we stopping them at the gate? Well, then that would back up traffic down South Belt. That would affect 159, South Belt, Muscuda Avenue. Just something that, logistically, we're working on better ways. Every day it's getting better. The message is getting out. There's different ways to communicate with the population that is coming there. But the key word is patience.
And the bottom line is if you just stop and realize there are people who, and we talked about yesterday, that when a new item comes out, the new Xbox or concert tickets, people go and stand in line for hours on hours to get a set of concert tickets or buy a new Xbox that just hit the market. If you got to sit in line a couple of hours to get something who may help your health or save your life, I think it's well worth that if you weigh those odds out. So again, we're going to continue to do the best we can. If you haven't signed up showing your interest, as we say every day, do so by going on the EMA page or the health department's page or the county website. 97,505 citizens have filled out that form showing their interest. That's 857 additions since yesterday. So that's the way to get the process started. And then from that point, you'll get a call from either the health department or one of the coalitions, one of the hospitals, scheduling you, telling you to go in and schedule your appointment. So as long as the vaccine keeps coming, Chairman Kern is working daily with our state representatives and the IDPH people to try to keep the flow of vaccine coming into our region. And so far, we're doing good of being able to fulfill those appointments. So those appointments don't get made unless we have the product in hand.
That's correct. And one other point that I want to make, there's a lot of questions about why we made the decision to increase the allotments. Why are you doing more every day? Because that's what's backing up traffic. And I think it's important for people to understand, if we stopped doing first doses just to get everybody the second dose, it would be another 21 days that no new people would get vaccines. So it's very important that you have patience, allow that a little bit longer of a wait, because that is being done to make sure that while those who already were lucky enough to get their first dose are getting their second dose, we don't want to slow down the process of getting new people in to start that vaccination process. So that increased number is a must.
And we have a great plan put together, and it's been working. There is some setback on the Moderna, and we're waiting. That's not us. We're waiting for that supply to come in. So for everyone who is sending messages and calling the call center asking about that, we're hearing your concerns, but it's a concern of ours because the health department is trying to find out when that's going to be coming, and then once they get that product in-house, then those appointments will be made. As long as it's not before your time limit, you're okay, and then I think it's up to 6 weeks after.
Yeah, they're
that
saying
date.
from Moderna, 28 days
Right.
to 6 weeks.
So just be patient, and once they get that supply in-house, then they'll determine how you're going to be notified. If you got it at the fairgrounds, you may come back there. If not, you may have to go to one of the hospitals or 330 West Main Street to get it, but you will be notified of that once we get that Moderna vaccine in-house. So it's not like we forgot about you. Believe me, the health department is got somebody working on this every day, and they just don't wake up in the morning and say, no, they worry about it every night when we're down there with them when they close, and then they start off bright and early trying to keep this process going. And like I said, it's been well thought of, and I think it's really smooth. The military commanders were there yesterday bragging about how we were the number one in the state as far as the vaccine goes and how smooth it was going. And that's a tribute to all of you Team St. Clair members. So please continue to have patience. We will be back tomorrow for day 352, and we'll be back momentarily with Cindy to translate this into our Spanish communities. Everybody have a good evening.
For more than 6 months, St. Clair County residents and businesses have been in the battle against COVID-19. As we see cases surging in the country and even close to home, we must again remind everyone the fight is not over. Team St. Clair has made it this far by following the guidance and direction of our public health professionals. Now is not the time to let our guard down. We must continue to wear a mask, watch our social distancing, and wash our hands. To get through this pandemic, we must work together.